Even better now. Good morning, everybody. My name is Heather DeSanto, and I'm the CEO and founder of Dish Events. And it's Friday at 10 a.m. when I enjoy coming on and having What's Your Dish conversations with friends and people I know in my world or I have yet to meet. And what's your dish conversation? It is me joined by somebody to talk about their who, what, why, where, and how of how they show up, pardon me, in their life, their business, or what I like to call the business of life. And so today I am super excited to have Dr. Sidhu with me, and she is my naturopathic doctor. And I'm going to get into a little bit of that with her because it took me a long time to delve into I'll call it alternative medicine for a lack of better words, but we'll talk about it, what that looks like. But yeah, I'm excited to talk all things health and wellness with you. And so with that, I will invite you to introduce yourself and tell everybody what your dish is all about.
Yes. Hello, everyone. Thank you, Heather. So I'm Dr. Sidhu. My first name is Navan. So obviously, if I know people even informally, like Heather, like it's okay to call me by my first name too, but obviously I know formally as well. So I'm a naturopathic doctor. So we do see patients, and what this looks like is providing treatments using natural therapies. It's a pretty broad range, so I like to kind of give all my patients options, but personally, I like to do a blend of both things in the sense of like the clinical, what's going on, let's figure this out. If we need to do blood work, supplements, that kind of stuff, but also like the like I know some people call it the woo woo part, but like the lifestyle, the more holistic, the part with like the acupuncture, and there's like acupuncture sometimes is considered, depending on how you look at it, like it could be considered more of like an energetic medicine. But it also does have obviously like the theory and some of the Western stuff to back it up. So yeah, that's what I personally like. I love doing that blend because I feel like that's where everything, I like the magic kind of happens. Like you get to actually work on like the deeper stuff that people sometimes neglect.
Mm.
Yeah, I love it.
Yeah. And so you have touched on all of the things that are the reasons why I said yes to coming to you. And so it's
Mhm.
interesting as I find who I'm connecting with on these conversations, how people are getting to know who I am as a person, because we keep a lot of, I think, women especially maybe keep their what's going on in their bodies, their stress levels, things like that to themselves. And I don't think that does anybody a service, which is how I
Mhm.
ended up delving in and starting to work with you, because I still go to my traditional doctor and get all of that stuff, but what does it look like to have somebody else look at me and have
Yeah.
conversations? We've had such great conversations about things.
Mhm.
And so I just want to share, because you didn't in your intro, and I'll kind of get
Yeah.
you to talk about it, but it is, I love how you described yourself in your bio, and so I'll share that on your behalf, and then I'll ask you to just talk about, is that common for you as far as your patients finding you and coming to you? And so, as you've said, you're a naturopathic doctor and you help patients go from feeling tired, drained, and stuck to feeling energetic, happy, and optimal again. And so
Mhm.
I can attest to an extraordinary experience I had back in December, and which we'll delve in a few minutes. I just got full body shakes, or like shivers, when I
Oh.
said that. And so I just love you to give your perspective on what I just shared, and how, yeah, what that might look like from a patient perspective.
So do you mean like in terms of like getting to those goals, like the as we said, like to feel energetic again, to feel like this. Um, I would say like that's something I'm very passionate about with like what I see in people, in the sense that so many people are like tired, you're just like stuck and going through it. I would say a lot of moms, I definitely see this in a lot of moms, where you're just like, okay, do this and then practice and then I'm stressed and then I can't sleep and then you know, you just keep going through this for like years on years. And some of it is like obviously hard to change, especially if you have like a newborn or a baby or
Mm.
even in like the young ages. But eventually you have to be like, okay, now what? Like you can't live this way forever. And then I feel like that's where moms finally have to start taking care of themselves in whatever sense, right? So whether that's like it's looking at your blood work to get you from feeling that like stuck and tired and drained to finally feeling good again, to even like the mental emotional part of like what's bogging you down, right?
Mm,
Like if even if I can like do your blood work to figure out what's sucking your energy, like if you have deficiencies, I think that's a very important part. But I think sometimes people miss that aspect. Like something is maybe not fulfilling you, something is maybe draining you more, even if it's like a friendship or like, or maybe there's a piece of your work where you don't feel happy, right? So, like, things like that, I think because we have that time and, like, I don't know, because that's the stuff I love, like, figuring out with people. I think that's where more of that magic happens. And I love seeing that transition of people being like, yeah, this is it. Or, like, yeah, this is now I feel better. Now I know what to do or, like, work on. Otherwise, I think when you're just stuck in it with yourself, like you don't not everybody reflects
mm.
and like tries to figure it out. And it's hard to also step back and, you know?
Yeah. Yeah. And so I'd like you to share what you taught me because you mentioned blood work. And so, as I shared earlier, I go to my regular doctor and I get my annual physical and all the things. And at that time, they do my blood work. And so it's checking B12 and all the other things, but I'm going to focus on the B12
Yeah.
because when I started to come to see you, you had asked for my blood work. And again, all
Mm,
transparency, we're getting to that this year and all the things.
yeah.
However, with the B12, I had said to Nevin that my doctor wasn't concerned about my B12. And so this was back in December.
Mhm.
And so then I said, I'm like, well, why would I need more B12 if my doctor is saying that it's fine? And
Yeah.
you shared with me, well, I'll ask you to share it.
Yeah.
What's the difference between a doctor and what you look at as far as levels of
Yeah.
B12?
So I think that's a very important part because obviously people will be like, I already did my blood work. They said it's fine. They didn't call me. And then I'll be like, well, I still want to see it, right? Or I want a copy. Or everybody should always get a copy for their own records, in my opinion, right? And the reason is because the like ranges that are on the blood work panels that we get, like on the results, they're more for like clinical diagnosis in the sense of like what level of B12 is so low that like you're gonna have a condition or gonna have such extreme symptoms, right? That they're like, you have to fix this right now. But like naturopathically, we've been taught what is the range and what is the value to get optimal health. So there's a lot of people. So B12 is one where the range is pretty big, depending on the like lab. Sometimes the lower range is 200, sometimes it's like 150. The upper range is usually like 600, but I like patients at 450. So I have seen people who are at like 200-ish, 250. They still feel really tired. They can still have like tingling and numbness in their fingers. They can have hair loss, like a lot of main symptoms with B12. So in those cases, we decide, okay, depending on how far off you are, do we want to increase it through your food? Do we need to increase absorption? Do you want a B12 shot? Like just some of the options. And patients do notice they feel better after, right? So it's about figuring out the optimal range versus like, okay, I'm just going to wait till it gets so bad to fix it. And you already are feeling bad in the process? So I think that's a part of it.
Yeah.
Yeah. And I remember when we went over your blood work, because you kept, that was a part of the frustration, right? That everything's always being told that it's fine and it's normal? And then when we go over it, you were like, wow, um, you were so shocked, I remember, because it just felt like, okay, you actually did internally feel like things are not okay. Like you don't feel good or aligned or whatever it was. And then I remember, I think there was even a few more things where I'm like, to me, this is borderline or this is like not the best. And sometimes that is more like validating to patients too, to see it in a different lens. And I'm not going to be here and tell patients to take things if they don't need to. Like we have that as well. So I'm not making it up, right? It's more just like from what I've learned as well, like, okay, maybe these two, three things versus like, imagine if, yeah, anyways.
I know. I can imagine it's like delving into, and I find this often with my guests, right? Because you're so passionate about what you do that we take you down a road, or I take you down a road, and then you're like, oh, but I could go over here and I could go over here. But I'm going
Yeah.
to stay on the B12 because I'm taking us on a journey, again, using me as an example. So back in December, it wasn't my first meeting with Dr. Sidhu. We had had an intake prior, and I had come in early December feeling very drained. And of
Mhm.
course, it was just leading into the holidays and all of these things. But that particular day, there was a lot. And this is when we had the discussion about the B12. And so I'll preface this because I want to go into the other thing that happened that day, or
Mhm.
not happened, that you performed, whatever, I don't know what
Good,
word to
yeah.
use, did on
The other
me.
treatment you had.
Thank you. That's the better way to put it. The other treatment I had that day. So the culmination of the two just was, I'll never, ever, ever in my entire life forget the feeling that I had for almost 2.5 weeks, I think, almost 3 weeks over the course of the holidays,
Mhm.
through some stressful times in my life as a result of that particular appointment. And so the second thing that we did that day, so I'll say I got a B12 shot that day. So we'll leave B12 for now. I
Yeah.
also, so Dr. Sidhu asked me if I had ever had acupuncture before.
Mhm.
And my recollection was I had had tennis elbow years ago when I was doing running events and we were packing swag bags over and over and over
Yeah.
again. I ended up getting tennis elbow, which I think acupuncture ended up being the thing that fixed it. But that day I said, I don't know what, like, whatever.
Yeah.
And so I'd like you to talk. I'll start off by asking you to talk about acupuncture, what it is. Yeah, and I'll leave it at that for now.
Yeah. So acupuncture, so the type that we do, so in our schooling, like for naturopaths, they teach us traditional Chinese acupuncture. So that throughout the 4 years, they teach us of how to exactly perform this. So I would kind of split acupuncture in two types, in the sense there's the kind of acupuncture that physios and chiros also do that's very much for pain. So it's very localized. Like if you have tennis elbow, your points are going to be on your elbow, right? Versus the Chinese medicine one, the theory behind it is different. They basically use like the person and it's very individualized, and we figure out what kind of like organ systems are like misaligned or maybe need more support, and we pick points around the body according to that. So essentially what it does, so in Chinese medicine they believe in like qi, which is energy, and our energy and our qi is supposed to flow freely throughout the body, through all organs, right? So let's say I have a patient, throughout the intake, I obviously find out things like maybe they're bloated, maybe they are very anxious, and then maybe they have things going on with hormones. Those are kind of like some typical ones. There's different points along the body that support this in different ways. So usually they're on like the legs, the arms, stuff like that. There's some on like the forehead that patients love. Um, so with this, what we're doing is we're basically opening up the channels and letting the energy flow again. And a lot of the times I find that like the patients who are very receptive, like sometimes I can pick up on it, like or I can also pick up when somebody maybe needs it. Like I can say that on that day I could feel Heather was stressed or like there was a lot going on, and like sometimes you just know, okay, somebody maybe just needs something right now to like help them tone down or relax or support the nervous system. So that's what we did that day, and then I think it was very good, and it was really nice to see Heather's reaction like on the day of and like the weeks after. And I know that the word you keep saying now is like you're a believer.
Yeah, yeah. And so I'm glad you described the difference of, because I had also, so after this treatment, as I said before, I was good for like 2.5 weeks, to the point where we went through, or I went through with a family member, a pretty stressful thing right around Christmas and New Year's. And for anybody that knows me, I'm pretty, I would say, high, like, I'll use the word high strung, but not in a like an awful way.
Yeah.
But stress impacts me. And so this particular event, I still believe that it would have impacted me differently had I not had acupuncture the week
Yeah.
before it happened. And so the mixture of, and I'm still trying to figure it out because we've connected since, and I've had another
Yeah.
acupuncture treatment, and it was a different, equally, I won't say equally good, but still beneficial. But I'm curious because the B12 shot that day and the acupuncture, like I feel like it was like super juice that went
Yeah.
into my body and kept me going like so
Yeah.
so well. So um yeah, I'll leave it at that. I'll leave that for now. But what
Yeah.
I want to ask you a question because I'm still fascinated by this.
Mhm.
Because so I agreed to do the acupuncture and I got on the table and then you said to me, "Can I look at your tongue?" And I was
Oh,
like,
yeah.
"What?" And so I would love you to describe that as well because it was fine, but I didn't
Good.
understand really that. And I think for the purpose of explaining what acupuncture is and how you do it, I think that makes sense to share.
Yeah. So it's very interesting. So in our like, I guess, education, we learned that like in Chinese medicine, they believe that the tongue tells you everything about the body, right? So they have taught us like which parts of the tongue mean what. For example, the tip of your tongue is considered your heart, the heart organ in the sense of like the heart governs like anxiety and poor sleep, like different things like that. So if I see something only at the tip of the tongue, usually it's related to that. And I even usually tell patients like this is what I saw, and then people will be like, "Oh yeah." It's like one of those, right? So different like areas mean different things, and then also what is on the different areas. So you might have seen before sometimes like people have a crack in their tongue, or maybe it's like bumpy on a certain side, or the color also means something. So the general color thing that I always look for is if the tongue is more purpley. So there are pink tongues, which is normal. If it's red or purpley, usually that means something else. The purple one is more related to the liver, but liver in the sense of like in Chinese medicine, the liver governs hormones. So a lot of like PMS and hormones and even like anger, frustration is related to the liver. So then I pick points according to that. Yeah,
Yes.
it's fun.
Yes, you
It's
did.
very interesting.
Yeah. And so then I'm just taking everybody through the journey because I think it's really important for people to I'm advocating. And as people know, I've told several people about my experience to the point where you've received some referrals and whatnot, but we'll
Yeah.
talk about that after. But like I legit felt so good after it. And so after you looked at my tongue, then you started putting in the needles. And I
Mhm.
am not a fan of needles. And so there was internally, and you may not have felt it that day, but there was a bit of trepidation because
Yeah.
and I want to say it's not like a needle that you get when you get blood drawn and things
Yeah.
like that.
Very different.
Very different. And so I would love you to share that as well because you proceeded to put them everywhere. Like, I think so in my legs, in my feet, in my arms, in my hands, in my right
Yeah.
here, I believe you
Ears
did,
sometimes. Yeah.
my
This is the.
ears.
Mhm.
And it was phenomenal to know that all of those things were in me and benefiting me without pain.
Yeah. Yeah. Good point.
So, yeah. So, can you describe, because like for anybody that like my husband as an example, like if
True.
I told him that would like he does not like needles,
Yeah.
wouldn't likely be open to acupuncture. So for anybody that like hears that and goes, what, can you explain
Yeah.
like the difference and how they go in and all of that kind of stuff?
Yeah, I would definitely say like unfortunately it's something that sometimes prevents some people from coming, but in the sense like these needles are different because they're very, very, very thin. Like it's like 0.15 millimeter is like what they tell us. I think it's 0.15 or 0.25, like very, very small. So they're very thin. Like they're, if you think about an injection, it needs to be so thick that a fluid comes through, right? So it's a lot thicker. This is like not like that. And they're also like, they're so thin that they can bend. Like you can like be like agile with it. Just to kind of like go to show like maybe like almost like a thread, I would say, or like two threads.
Yep.
But yeah, it's really thin in that sense. And the other thing to know is they're always like coated with something so that they don't hurt as well. It's not like a painkiller or anything. I think it's just like, yeah, something on there to make it easier. And then in general, acupuncture points are in really safe spots. Like in general, most of the points are in areas where like there is no other like veins or arteries. Like there's no major organs. There's it's mainly just like muscle or like it's like a safe area in general. So that's also something of like why it doesn't hurt as much, why it's like not as dangerous as like it maybe looks, right? Like here, there's like nothing here. It's just the muscle, you know? So it's a pretty like easy point in that sense. And even then, like if I ever have to do places that are close to other things, like we obviously know how deep to go or not to go. There's different angles and different like techniques so that we don't get close to anything. Like I know how to feel for different arteries so I don't go there, right? Yeah, in case that makes anybody feel better. But yeah, they're very, very, very thin and generally in areas that don't hurt.
Yeah. Well, and so then I'm gonna tell the next part of my experience because I wouldn't say it hurt. Like that's
Yeah.
not the way to describe it.
Yeah.
However, again, Dr. Sidhu said that she had noticed that day and I had shared some things and whatnot. And so she strategically placed them in all of the places. And the only one that, and I would say, rather than the word hurt, I would say there was a bit of a burning sensation. I think
Mhm.
that's the best way to put it, which was one on my right leg, just at the top near my, like in my shin, I guess, kind of more to the side. And so, and that one was the only one because you had asked me if there were any that were hurting or
Mhm.
doing anything, and that was the only one. And so if you could share, I'm open. I don't remember what it was, but I remember at the time when I said, "Oh, what's that?" and you shared with me, and then I was like, "Yep, that ticks all the boxes." And so in my mind, it was one of those. And if you're looking for somebody that maybe enters into these things and is looking for validation that it's working, you know what I
Yeah.
mean?
Yeah.
Like that burning for me in that moment was like, oh, yeah, I get it. That's where it needed to work. And the
Yeah.
burning was that. So, can you share just as an example what that was tapping into?
So that point specifically is a very like popular point. Um, it helps to like overall support the body, but in the sense of like it helps with the flow of the liver energy. So liver chi is what we call it. So opening up that liver channel, so that's more for the hormones, letting the hormones flow, as well as like the stress and like that component of like liver stuff. Um, It's good for a lot of things, that one. It's kind of called, like considered like our mega point, like to support energy, to support stress and hormones. Yeah, it has a lot of good benefits in general.
Wow, that's amazing. So, actually, because you've mentioned hormones a few times, and so again, in full transparency of the reason why I finally, and I'll say finally because people had talked, friends, acquaintances, whatnot, had talked about seeing a naturopath.
Mm.
Not again, not necessarily instead of a
Yeah,
doctor, but
yeah.
and I don't like a medicine doctor, even that maybe I should even ask you to describe the difference because you're a doctor, I have a doctor, you know what I mean, like the difference in that way. But anyways, that maybe what that'll come up after. um and I forget where I was going now. Oh yeah, hormones. So I just turned 50 last year. Who, and I honestly, like in true fact, like I don't know if I'm in denial or
Yeah.
if it's just like I was like menopause. Like no, I'm not peri, I'm not I'm not in it, all the things. And so denial wise, I was like, however, things are changing in my body and all this kind of stuff, which then prompted me. So from a um, um, hormone perspective, do you see more women come to your practice when they're hitting perimenopause and menopause, or do you find now that women are really advocating for themselves for naturopathic benefits throughout their journey?
I would say I see a combination. It's interesting. I've seen a lot of people who are not even in peri, but they're like, I want to prevent it or I want to make it as seamless as possible, which I think is even the best case because if somebody comes to me with like already like 10 out of 10 symptoms, obviously it'll take you a little bit more time to come down and you are already experiencing that level of discomfort, right? Versus like the people who are like preventative and want to do it. I found that very interesting. But I would say like younger girls are coming. Like I do get a lot of people in their 20s and 30s, and whether it's for fertility or PCOS or other hormone things, but a lot of people realize like, okay, we maybe don't want to be on the pill forever. Or we don't want to use like XYZ pill for this hormone thing that they want to like do it naturally. And I actually do think that some parts of like social media have helped with that in the sense that like there's so many like influencers or health people now that on TikTok and Instagram talk about like, which I know they already talk about menopause a lot, but they
Yeah.
also talk about like everything else of like don't be on the pill and don't do this. And they have such like obviously different opinions and stuff. But yeah, there's a lot of people sharing their story of like I naturally did this, right?
Wow.
So I think that a lot of people know now that like, oh, there is an option to reverse or to help or to complement their care with medical stuff.
Yeah, that's
It's
interesting and
interesting.
good to hear because again, like somebody like myself in my 20s, like I don't even like
Yeah,
obviously I heard of the word naturopath, but it was never ever ever on my radar.
yeah.
And which again probably was why I was so resistant when I got to the point where
Mhm.
well, why not? But it was also, and I think truthfully too, it's because so Dr. Nevin and I met through FemCity,
Mhm.
and her coming to those meetings and talking about what she was doing. I think some other femmes had talked about their experience with you, and so I think it was probably that a bit of wanting to support you, but and just
Yeah.
why not? You know, because again, well, if we want to talk about benefits and things like that, right? From an insurance, it was later in the year, and I still had credits and things like
Yeah.
that, and
It kind of
so
helped to make that jump too, right?
yeah. Well, and I'd like you to talk about that because I think also that was maybe a mindset of mine is that those alternative medicine offerings
Mhm.
were not recognized by
Yeah.
insurance um,
Like
agency, whatever you
OHIP.
call them,
Yeah, yeah.
OHIP and stuff. So you don't naturally go that route because
Mhm.
you want to get your stuff paid for. And so now I don't know if it's always been that way. So that's I guess the question. Has it always been where these types of benefits and whatnot are covered under insurance?
Yeah, so from what I know, I don't think naturopath has ever been covered by OHIP. I think it's always like private and private insurance. There's so much talk. This is like more like legal and the
Mm-hmm.
politics and political side of all of this. But there always is some sort of push sometimes from our like unions and our like colleges that they are pushing sometimes with the Ontario government to get coverage. But there is a lot of like people in our profession who are like yes and no because the benefit sometimes of our care is like the ability to do more and less and like having the extra time. But if you're under OHIP, it's gonna probably change the process, you know? Like it's probably gonna be much more like you need to see this many people and you know that and I think that changes a lot of how you deliver care,
Yeah, I would think so.
right? That
No, yeah.
I don't know if it'll solve the problem. Like I can give people supplements quickly, but I won't be able to talk to them about other stuff.
Interesting. And I would say the benefit of what I've experienced is that, yes,
Mhm.
I get treatments, but it's also just the talking. And I have shared this with other peer. When I say peers, I mean people in my community that are older. And I don't know how old you are, but I
Mhm.
did have a conversation where with somebody where I was sharing that you're in my conversations, you look at things, and I will get into it shortly, but I'm all about perspective, right? And
Mm,
you being younger than me,
mm.
you share a whole other perspective on stress, and even I'll even say parenting, even though you're not yet a parent. Like,
Yeah, I know.
it's been an interesting thing to be able to benefit from you and your perspective
Yeah.
in this practice and journey that I'm going on. And I think it's fantastic. So I don't know if everybody finds that, but the other quick thing I would, and maybe it's not even quick, but again, because of conversations I've been having lately and the misunderstanding, I guess I think I'll put it in, and I'm not an expert on this by any stretch, but HRT, so hormone replacement therapy, um, my understanding is folks like my mom, for example,
Mm.
when she was going through menopause, HRT was not encouraged. It was almost to the point where if you do it, you will get this, that, and the other thing. Whereas over time, I believe that has changed. And so, can you give your perspective on HRT? Do you offer it? Is that even a, like, I don't, yeah. Can you just talk about that and any in your perspective on
Yeah.
HRT?
I would say so. HRT is interesting. I would say that there is a lot of benefit for it in the sense, like for people who have very bad or menopause, I guess, symptoms, or even in terms of like hot flashes, sleep, if like nothing's working, it does have a lot of benefit. Um, it is something I can offer, but I don't offer it. I feel like most of my patients like and love to do all the other stuff. Like a lot of the people, interestingly, who come through my door for menopause, the first thing they say is like, we don't want to take hormones.
Ah,
Right?
I
Like
think I
they'll
said
say,
that.
yeah, there's a lot of people who come through and they're like, we don't want to take hormones. They want to do anything like herbal or nutrition or acupuncture or like all the other options. They want to exert them before going that route. And usually they feel better with all the other stuff anyways. So I've never really had to tap into it. There are naturopaths who like only do HRT, so I would honestly just refer my patient to them if I needed to, because like though I'm able to do it, I feel like I would want to do extra training before I do it. Because I'm so good at all the other stuff that yeah, I don't do it much. But I would say there is a lot of benefit. I know people who take it. There are patients who've already come in on it and it does help them a lot.
Hmm.
Yeah, there's a lot of stigma. There is like mixed, obviously, research, even in the sense of like you're taking hormones, it'll help prevent some things, but it might increase risk for certain things in terms of some types of cancers and stuff. But a lot of the patients, it's interesting, who are on it, they're like, they don't care. Like they know the risk and they're very aware, but their symptoms are so bad that they're like, they just want relief. They don't care if this happens in 10, 20 years or whatever the case. Like it's just that bad that to them, they assume the risk and they're fine, right?
Yeah. Hmm.
Yeah. Versus, I would say like the people who can't do it. Maybe this is also the people who come through my door are like the people who already have a history of like clotting or breast cancer or like lumps in the breast. They already are very cautious and maybe are also told they can't do it. So that's the people I end up getting.
Ah, that's interesting. Thank
Hmm.
you for sharing that, because I actually, it's funny because I, again, in that conversation, I was like, oh, I'll have to ask her the next time I go see her, because it's not, and again, it's not something that I think I need or am interested in at this point. But yeah, I'm very interested in it, in knowing and being able to
Yeah.
understand the benefits or the not of why somebody would want to take it. And
Mhm.
I think, to your point, if I was somebody that was like miserable all the time, in pain,
Yeah,
getting hot flashes, can't sleep, all the things that I know
exactly.
some people are going through, well, then heck yeah, I'd want an immediate
Yeah,
cure or something that would alleviate that for me, because
yeah,
I, like, why would you want to feel crappy? But
yeah,
anyways, yeah, it's
exactly.
it's an interesting thing. So, which then leads me to another thing that um I feel like we're having my appointment through this
No,
conversation
that's okay. I feel like
because
there's so many things to talk about. Like, I want to ask you something too.
so I would love you to share because the first time we met, I was talking about the fact, and again, this is where we get to where you had talked at the beginning about the woo-woo of what you do, because again, in full transparency, because I am on a path of awareness, I
Mm,
am a very aware of my cycle and how it is impacted by the moon cycles.
yeah.
And again, if you're watching and you're like, okay, crazy lady, I'm going to turn you off now because you're too woo woo, it's a thing. I
Mhm.
believe it in my core, and there's other people that can really explain it and all the things. However, when I was talking to you about this, you had recommended seed cycling to me.
Mm,
And while I have not been a very good girl as far as doing the seed cycling, I still find it very fascinating and what it is, why you recommended it, and all of the things. So if you can share a bit about that, that would be awesome.
yeah, it's very interesting. I would say so seed cycling, there's a few ways that it works, but one of the main things is that different seeds support different hormones, right? So off the top of my head, I always get them mixed up. I just know that there's flax, sunflower, pumpkin, and maybe I think it's sesame.
Yeah, I think it
Um,
is. Yeah.
yeah, so there's four of them, but two are kind of in the first half of our cycle, so from period to ovulation, and then two of them are in the second half, so um, ovulation to your next period. But what they do is that obviously they're naturally like healthy fats, so healthy fats already support hormones, so does protein, and then because of the components in the different seeds, they help support hormones, whether it's estrogen in one part or it's progesterone in the other. But I've also read things about how they also help support, like, and they align with the moon cycle in that sense, right? Because the moon cycle does also line up with usually menstrual cycles, and basically you're kind of just like regulating your body according to like the seeds and also your hormones and the cycle. Like there's something about that.
Yep.
Yeah. I don't remember the exact thing. Like I know, yeah.
It's okay because when I chop this part out, I will take what you sent me and I will share it with people because again,
Yeah.
like I have because and so I'll just let's be transparent about this and why the reason of I've not implemented it is
Yeah.
because it's a change to my behavior.
Mm.
And so why I like acupuncture versus maybe having started this seed cycling.
Yeah.
Acupuncture was the quick hit, right? It's in the appointment, it gets done, you walk out, you feel amazing.
Yeah.
Whereas seed cycling, you got to go and buy the stuff and you got to remember where you are in your cycle and all the things. However, it is my mission this year to try it and see because as an example why I think it could benefit me. So when I am in, so for me, the full moon is when I am impacted more emotionally. That week is usually when it's a bit of a
Yeah.
storm of emotions up and down and all the things. And for the benefit of the people I live with, sometimes I think there could be ways to manage those hormones. And that's how this seed cycling came to be a
Yeah.
conversation, right? Because
Exactly.
yeah, and why not? And like you say, they're healthy fats and things that your body can benefit from anyway. So yeah, we'll leave that. So you said you had a question of me. I'm like, this never happens, but I'll let
Never.
you ask me.
Well, I wanted to hear your story of like going from skeptical to like to yeah, to being open to this. I know you touched on it a bit, but like yeah, like what exactly I guess opened you up?
So I think for me, again, it was getting to know you through FemCity.
Okay.
So if we want to talk about business, this know, like, and trust factor, right?
Yeah.
Going in and finding a naturopath and putting myself out there emotionally and talking about things and whatnot, you want to feel
Mm.
Like you're in good hands, and it's like you're talking. This is for me, like I'm generalizing here, but for me it was, I wanted to be able to feel safe to talk about the things that I was feeling at that time.
Mhm.
And it's not, I have a male doctor, so
Yeah.
that for me, talking about female things, while he would help, because he was very, very helpful when I was getting ready for Peru and all the things, but to talk to him about womanly things, I don't feel comfortable. Right. And so I think that may have been the tipping point, again, with in combination with being surrounded by people that just talk about menopause all the time. And I think the first thing I said to you was like, I don't want to hear the word anymore. I
Yeah.
don't want to, I'm in denial where I am in the process of it. Because for
Yeah.
me, I, I know how to make myself feel good. I go for
Mhm.
walks. I hang out with the people that make me feel good. I laugh. I listen to music. I do all of that kind of stuff. So, that from a vibration standpoint, I do that. However, it got to a point where, like, why not get checked to see if there are other things that can be
Mhm.
done to
Yeah.
help me be a little more level throughout the year? And so, that I think was the tipping point, as
Yeah.
well as just getting to a point where it wasn't a time to go and see my doctor, and I was going through some things emotionally and
Mhm.
physically, that I was like, it's time. So I think that it was a bit of a combination of that. And as I shared earlier, so with the acupuncture, and this is where we come into, from a business perspective, why referrals are so important. So my experience in December, like I said, 2.5 weeks after that, and we never really got back to that, which I would love to, because I almost think now it was the B12 shot more
Yeah.
that made me feel like I had rocket fuel behind me.
That does do that.
Yeah, than the acupuncture. I had attributed to the acupuncture, but in more, because I've had it since, didn't have the same like rocket fuel results.
Yeah.
I've been reflecting and I'm like, oh, maybe it was the B12 shot. So I'm very curious how often you can get those,
We should do
because
that separately so you see it in isolation.
okay, maybe we'll do that next time, because honestly, I'm now even more thinking it was that, because
Hmm.
that is the first time I've talked about that, about having rocket fuel, but that's how I felt,
Yeah.
to the point where I was telling everybody about my experience. So then fast forward to this month, one of my hockey mom friends was going through significant shoulder pain. And
Hmm.
so, and in transparency, we haven't seen each other, so I didn't tell you. So I
Hmm.
had been talking to her husband about my experience and the
Yeah.
levity and all of that. And so when she was talking about her shoulder, her husband said to her, you need to go talk to Heather, because she did something that made her
Oh,
feel better, and you need to go figure that out. And so, like, that's how it came to be. I had the discussion, then talked to her. She ended up calling you. And so I think in her case, though, and then this goes back to the acupuncture, when you saw her, I believe you may have done targeted on
hmm.
her versus the what you did for me. Is that true?
Yes.
Because she walked out again, saw her shortly after she saw you, and she was so grateful for the
Yeah.
referral because of
Yeah.
the relief she received.
Yeah, it was very nice to see her. I think her case was also very like she reacted really positively and like it worked really well. She had a lot of relief even like in the visit, right? So it's very nice to see that. Um and yeah, I would say even like I saw her, I think a few times after, and in general, like when you see the person feel better, like physically and even mentally, because pain is like it has a mental component, or it can make you feel really, upset or down or frustrated. It's like nice to see that transition, which I'm sure you've heard a bit about as well from her,
Yes.
you
Oh yeah. Like yeah, and
know?
like I had said to her at the time, I was referring her because of that specific thing, but again, from a referral standpoint, she's similar in age to me,
Yeah.
going through some of the same things, again through conversations we've had over the years we've known each other. why not do that referral? Because yes, it could have been just fixing that one thing, but how
Hmm.
many other things can you help her so with
Yeah.
to be able to optimize and be in optimal health, which is what you want to do for people. So
Yeah.
um
Agreed.
I'm gonna ask you to, so I chuckled actually when you, because I think this is so brave, and I think again it goes back to maybe your age, but you're on TikTok. Like, good for you.
Honestly, I never had TikTok till like a year ago, and I just did it for like work stuff, right? And I just like repurposed the same stuff from Instagram.
Nice. Yeah. When I saw that,
Yeah,
I
it
was
is.
like, brave you. Like, it's just one of those, I think,
Uh,
truthfully, I think it could benefit me to be on TikTok to do some of the things that I do. But I have
yeah.
always envisioned my kids like going through TikTok and they're like, oh my God, there's my mother. Like, like I have that in my mindset
Oh, my mom's
because,
on my
again,
For You page.
right? And I don't even know what that means. Like, that's how bad it is as far as where I am generationally and whatnot. Anyways, but I thought that was pretty cool. So if you could share your LinkedIn and Instagram where people can follow you, that would be awesome.
Yes. Do you want me to say it verbally?
Yeah. Yeah.
So my my Instagram and my TikTok is mindfully medicine, and then my LinkedIn, I think it's Dr. Sidhu ND. Yeah,
Yeah.
I know I sent you
Amazing.
the links as well, so in case you need to put it.
Yeah, absolutely. Okay, we're going to pop into the portion where we talk about perspective. So these are tools that I use in my business. They're called points of view, and they can be used from things from conversation starters to workshops where we get deep and dirty into different topics and whatnot. But for the purposes of these, I use my favorite one, which is called Punctum, and I ask my guests to either pick a word or a question that you're going to give your random perspective on.
Oh, wait, but do I pick from the cards or like I
No.
pick a random?
You
I
just
have,
say, do you want a word or do you want a question? And then we're going to go into the woo woo and I'm going to pick one and we're going to talk about it.
I want a question.
You want a question? Okay. So here they are here. There's 33 of them. And much like tarot card ish, I just shuffle them until one comes out that resonates. Oh,
Like,
well, this is going to be fun because
hmm,
these are all perspective. And again, these are meant for you just in the question part of they're easier to do because you're answering a question. But the purpose of these is to share, so in groups and things, to hear what people are saying and to be able to either help them through something and things like that. So anyways, this one I find very interesting because this one's pretty personal, and so you don't have to go deep, but we talked about a lot of what my challenges have been and why I came to you.
hmm,
So your question is, what challenges am I dealing with right now? And so this can be
interesting.
personal or business. You don't need to be heavy. It's just, again, this is the for the point of where we're sharing as business
Yeah,
owners
yeah, yeah.
what's going on.
I would say like one thing I'm like a challenge I'm trying to get through is like um what's that word? I'm trying to like reflect more on what things like replenish me and give me energy versus drain me. And like I realized recently that it's more than what I thought in the sense of like, um, I sometimes think we just think like, okay, what about work? Like, I think because we're entrepreneurs or business people, we're always thinking, I personally am always thinking, okay, which part of my work is my hours, is it my days, is it my this, is it the way I schedule, is it my break? Like things like that. But now I'm like, no, I have to think like more. It's like, okay, maybe these types of social interactions, maybe these people, maybe like these people after this day, maybe like, so that's kind of like what I'm trying to figure out. But I feel like it's very impactful. I've been like doing it for a bit of time now. So it's thankfully not as much of a challenge because I'm figuring it out. But like, yeah, I feel like not too many people think like this. And I think that we should.
Yep.
You know what I
Yep.
mean?
Yeah, I absolutely do. And I'll give you thank you for sharing that because um it's funny actually what you just said. You like gave me my trigger word.
Oh,
In the no, it's just fine. But I noticed I wrote this down on in a book last year. I was just going through a book
oh,
and the word should is
oh yeah.
and right how we and I have somebody gifted this to me a long time ago and I just continue to use it is how we shouldn't should on ourselves, right? Like,
Mhm.
right, why should we do these things?
Yeah.
But I know the in the context that you used it was is beneficial because yes, we could make a choice to reflect every month. And so I have somebody, a friend of mine that actually does this for business owners on a monthly basis. Hers was last night as an example where
Mhm.
she brings in business owners and it's a very structured format where you go through your calendar for the month and what you analyze what you did, what you didn't do, what
Mhm.
lifted you up, what didn't. And then ultimately you go through an exercise of choosing things you want to stop, things you want to start, things you want to change. And if you do that on a monthly basis, which I've done, I
Mhm.
don't, I'm not as good at it. And it's funny that we're talking about this because I would say it's a challenge of mine right now because I'm not doing it as much as I used to and saw the benefits at that time.
Mhm.
Because it is important to define for yourself the things that do light you up because it's the same as anything else. If I'm coming to you as a to see you as a naturopath to
Mhm.
fix the problems, I'm aware of what's going on. Just I can become more aware of what's going on with me emotionally by actually reflecting and looking at
Yeah.
what I like to do, what I don't like to do, who I like to hang out with, where I want to network. So
Mhm.
a perfect example is our Fem City group. I
Yeah.
love our Fem City group, but I
Yeah.
can't stand that it's virtual,
Mm.
right? Because I like to be in people's company. However,
Yeah.
I chose that group because I want to meet people across Ontario versus what I used to do was a small group. So it's interesting how,
Mhm.
but I love that you're doing that, and I think you're right in that it is an important exercise for somebody to, for business owners, even like you don't even need to be a business owner, quite frankly. Like I think about it for my kids, right? Like where do they spend their time, which friends and lift them up, which ones don't, all of that kind of
Mhm.
stuff. I think it could be a good practice for anybody. So thank you
Yeah.
for
No
sharing that.
problem.
I love it. And then the other question I ask is, what is your favorite dish? Meaning, is there something that you cook that somebody that you love cooks for you, a restaurant that you go to? What's your favorite dish?
God, I love so many types of food. If I had to think like my favorite like comfort food, it's something my mom makes. It's like a traditional it's kind of like this it's kind of like this traditional Indian. It's like kidney beans and rice. But it's
Ooh.
like with a gravy. Like there's yeah, but it's like one of those things where it's like when it's warm and you eat it, like we ate it when we were kids all the time. So when we
Yes.
like make it, you just feel so like warm inside.
Yeah. Well, and I bet you it triggers memories, like you
Yeah.
said, like when you grew up. It sounds almost like similar to a stew or a soup
Yeah, it
where
is.
in the wintertime, those things make you feel good and warm and cozy. And
Yeah.
I love that. Thank you for sharing.
What's your
Does she
favorite dish?
share her recipe?
I know the recipe. I've made it before.
Oh, well, then maybe you need to like, if it, you need to
Yeah,
share it
maybe
or something.
a little bit complicated, but we can figure
Is
it
it
out.
really? Because it sounds so simple in the way that you just said it.
Like, I mean, yeah, I guess in the way I said it, but I mean, like, a lot of like Indian foods, you have to make like this thing first with all this like onion and like spices and stuff first as like the base.
Right.
Like onion and garlic and all that stuff. So that's the part that's a little bit more complex because it's not just like we're boiling the beans, right? Like we're doing all this stuff to it. Yeah,
It sounds delicious. And now
it's really
you've made
good.
me really, really hungry. I love it.
I wish I had our tea right now.
Right? Oh, I love it. Well, we're going to finish off, but the what I'd like you to share is You have told me that you have an offering. And so I would love you to share that for anybody that sees this conversation, maybe has been thinking about seeing a naturopath. What does that look like to come and see you?
Yeah, so something that we offer is 15-minute meet and greets so that people can share what's going on. I kind of give them like a brief assessment in the sense of like, this is what I kind of think is going on, but like we have to dive into it and kind of in terms of like treatment options, right? So whether it's acupuncture, whether I think for them we need to do nutrition first. But sometimes I feel like it helps people get that idea of like what exactly can we do for their case, or is it something I see or not, in that sense, and to see if we even connect in that way or yeah.
That's important too. And so this is a free 15-minute consult. And I think that you've touched on something really important. And I think well, it's part of the explanation of how I came to you. You're not always going to jive with everybody you come across. And again, to the point of me having come to you, was we had built up a friendship, a connection through our networking that then had me come to you.
Yeah,
But there's tons of naturopaths out there.
yeah,
And
true.
you want to, when you're talking about female things, you want to be able to be comfortable with who you're talking to. And so I very much appreciate you and all that you've done so far for me and what you will continue as we work together and whatnot. Um, Oh, I was like, there's one more thing, and I didn't grab it, and it's over to my left. It's my parking pass for actually where you are. So if you could
Oh,
share where you are, the practice that you're a part of.
yes.
So if somebody wants to physically find you, where would they physically find you?
So to physically find me, I will be at Trinity Chiropractic. That is on like it's called Young and Younghurst, but it's basically by Hillcrest. If anybody needs to know, in Richmond Hill. I also am in Bolton some days. That one is called Wildflower Health. It's off of Highway 50 and Simona.
Nice. I
Yeah.
love it. Love it. Love it.
Yeah.
Well, thank you so very much for joining me today. If you're watching and are interested in being a guest, I would love to have you. If you know anybody that wants to do this, Dr. Heather is the
Mm.
chiropractor that
I think
is
she
at,
would do it. I'm sure.
yeah. So actually, I don't think I've shared with you. Maybe she did. Her and I were at an event a couple of weeks ago, and she was there. And so I got chatting with her, and we may be doing something together. So it's amazing
Good.
how
Yeah.
connections come together, and how beautiful things
Yeah. And
come
how
together.
things turn out or like what comes of it. Right.
Yeah.
I love
Yeah.
that.
So thank you. And yeah, again, if anybody wants to be a guest, please reach out to me. You can send me an email at heather@dishevents.ca, and I will return an email to you with information. We can get you scheduled in, and we'll have a lovely conversation like I did with Dr. Sidhu today. And so, Dr. Navan, I am so happy. I will give your practice a call this afternoon to book my next appointment because I haven't done that yet this week. But I thank you so very much for joining me and sharing your wisdom. And I just am very grateful for you and the help that you've provided me thus far. And I look forward to many more opportunities to work together.
Yeah. I'm so happy I met you too.
Uh, Thank you so much. All right. Bye for now, everybody. Have a
Bye.
great day.